Dr. Leeman, Larry, is a scuba enthusiast, mountain climber, and professor of family health and addiction at the University of Mexico. He also coordinates and collaborates with MAPS trials in psilocybin, MDMA, and other unusual compounds, including sacituzumab's, phenethylamines, and tryptamines. He is the seminal figure in pharmacology and clinical applications in New Mexico. Larry will speak to us about his work at this moment. Larry, please.
Thank you, Leonard. It's a privilege to be on the stage with you. Whew. Welcome, everybody. I'm so happy to be here with you to see this happening in our state. There's been so much leading up to this over the last few years. So just take a breath together and feel some of the happiness of what we've created so far and what we're going to create today. Look around you for a second. We're getting on a journey. One of my recommendations, if you're on a journey, know who's next to you. So take a look. Take a look who's next to you. Maybe smile at somebody. Just get a feeling of being in a group on a journey, because that's what we're going to be here for today. So I'm going to talk, there's a title up, I guess, behind me, but I'm actually thinking really what I'm talking about is healing the communal body, healing our communal body in New Mexico and many of our different groups. So that's what I'm going to talk about. I'm going to share some of my path and how did I get here to go from the way I trained to be doing what I'm doing now. I wound up, landed in New Mexico. It's not wound up. I think there's a lot of serendipity that happens in our lives. So I actually wound up being in New Mexico about 30 years ago. Came out with a professor looking at domestic violence in Taos. Little did I know that trauma in New Mexico is going to be my life. While I was there, I was studying health beliefs of peoples in northern New Mexico, and actually the notion of the communal body became the paper and the work that I wrote there. And the communal body is really kind of a theme that we'll be sharing through today. I fell in love with New Mexico. I fell in love with the people. I came and studied family medicine at UNM. And then I went out to the reservation. I practiced for 7 years out in Rama and Zuni. I learned at that point in time that I was somebody who liked to work with people in transformation. So I spent about 20 years where the main transformation is birth, sometimes death. Now it's birth and death. And then in recovery, people hearing from recovery, which is quite a transformation. While I was living out in Zuni and Rama, I was invited by families into ceremonies of the Native American Church. I got to witness families healing. I got to witness healing occurring with people with alcohol and addiction out there. It's had a deep resonance in my life, a resonance that I sort of had to keep to myself until fairly recently. While I was out there, I had also my first experiences as a researcher where the Zuni tribe wanted us to gather evidence that it was safe for people to be birthing on the tribal land because they didn't want everybody to have to go to Gallup. So I got to start with community research. My work at UNM eventually focused on perinatal substance use, a program called Milagro, where we care for people who are pregnant using opioids, using methamphetamine, and taking care of their babies. It's beautiful to work and see the transformation that occurs. I thought we were doing, a lot by just working on addiction, but at some point I realized that wasn't really what it was all about. I was a little bit slow. It took me a little bit of time to figure it out, but eventually I realized that it was the trauma that was there because I would take care of people during a pregnancy and their baby. They would do well, they would be on a path, and then they would start using again, and I'd see them back in another pregnancy. When I resonated with that, I recalled my experiences in my life. I've shared some of them are more personal, but just experiences with psychedelic therapies for trauma and addiction. And this was back in 2018, and I was like, how am I going to do this here? And I was like, well, I'm eligible for a sabbatical. Maybe they'll give me a sabbatical in psychedelic therapies for trauma and addiction. And I was really unsure. As I told my friends and colleagues, I could see a couple of results. They might support this, or they might call the medical board and say, we have a doctor very interested in psychedelic therapies. You might want to look into that. Luckily, I was met with lots of enthusiasm from the university. Some of it because people knew about psychedelic therapies. Some of it out of a sense of despair and desperation. I mean, the trauma that we in New Mexico, if you look at the intermingled things of addiction, suicide, gun violence, other mental health issues, is really large. We have a lot of beauty on our state, but we also have a lot of trauma. The sabbatical allowed me to learn about doing clinical 1 trials with the idea of bringing them back here to New Mexico. We had some psychedelic therapies here. I want to honor those people. Rick Strassman, some of you I'm sure have heard of and familiar with, was at UNM, did the first research. Yay, Rick. Did the first research in DMT that was allowed for about 20 years, was able to do that in the 1990s, and then Michael Bogenschutz and Snehal Bhatt with psilocybin after that for alcohol. So we have a history here. We all should be proud of our history of research. But let's be clear, that's not where psychedelics started in New Mexico, not anywhere close. You all know that. So, we have the history of indigenous use in New Mexico, both from people native to here and Maztecs and other people that are there. But we also have another legacy that is often not spoken about. I'm just going to speak about it to give it a little bit of name, whatever you want to call it. People are using the word legacy healers now. People are using the word the underground. But we have deep roots of people working using psychedelic therapies in New Mexico, since the 1970s. And I just want to honor that. Those people, deserve total thanks for keeping those ways and studying that. So I want to honor that. All right, so I went and did the sabbatical. I got trained in MDMA therapy with the idea of bringing back here and psilocybin as well. But something kept drawing me to working in groups and seeing what that's like. And maybe it's the idea of still healing the communal body. So I spent 4 or 5 years studying something called holotropic breath work. Some of you have probably heard of that. In holotropic breath work, people go on a journey. It's a psychedelic journey. They have music, they have breath, and many people have journeys that are as powerful as ones on psychedelic therapies. I've taught at places where people thought that was their most powerful journeys. So again, I'm a little slow sometimes, but I looked here going, there's something more here than the medicine. The container itself is really powerful. We'll sometimes call that the secret sauce of holotropic breath work, is people being in circle and opening in their hearts. So that was one of my first works with groups. I was then lucky enough to be able to spend time in Europe, Jamaica, Mexico, and see group therapies and see how beautiful those can be worked for healing. And that's some of what I'm going to be sharing here, is the idea that group therapies, especially for trauma and addiction, have a lot of power. So I returned home after the sabbatical to be at UNM with the goal of really starting up to do research here. The first study that I was interested in doing is working with MDMA for postpartum people with PTSD and opioid use disorder. Took a number of years to get that study up and going. The FDA was very reluctant to study addiction, but we finally have it started and have seen people. Of the people we've seen, one of the most powerful thing is the first 2 people. I really learned that a lot of what they wanted to do here is to just be able to feel, that the amount of numbing when you've gone through decades of being with opioids is just being able to feel is a really good intention. Did other studies, starting up other studies, but before I talk about them, I want to kind of pause. I want to put a whole nother direction a little bit here, because right around that time, we got a call really from peoples of northern New Mexico, both Taos and Rio Arriba County, interested in, can we help with addiction? Basically, it was a very simple ask, like, we have a lot of addiction in our counties. We know you're working with psychedelic therapies. How can we help? That ask went out first to the Hefter Foundation and Dr. George Greer from Santa Fe. A lot of you know George, so I want to call him out for this. What we then did over about a year, we had groups were meeting, this basically in a process. We didn't really know what to call it then. I would now call it a community engagement and planning. But we had people that were involved in substance use, mental health, and to look at what kind of a model we could do. At the time, we didn't think psilocybin was possible, so we initially looked at ketamine, and getting ketamine approved as group work. That that proposal was actually very hard to get anyone to fund. Nobody really wanted to fund ketamine. And then I discovered how challenging it can be to actually get group work funded. I have some NIH grants, so I thought, okay, I'll call NIH and say, hey, I want to do research here. They were like, well, we're not actually going to do anything with group work with psychedelics until we have enough, individual level studies. And I kind of did the little math there of how long, and I was like, that's going to take 10 years. We're having like epidemics here, and that was a learning thing to realize that we might need to look for different ways to study that, just as I think people are looking at different ways to access psychedelics. So the FDA pathway, although an important pathway, and I do research in that way, honor, but that the idea of having another pathway because we don't have 10 years. So what's wound up from that work that emerged from the request from northern New Mexico is some pilot studies that I'll share with you in a little bit. I'm going to take a turn down another river in this journey, which is the river of the state and what happened in the state. So about 2022 was the first time anyone contacted me about an interest in, is there something these therapies can be doing? Went out, I think it was 23, and testified with the legislature. People wanted to know how these therapies work, what was the research. And there was strong interest and enthusiasm. This is only 2 years ago. From that 2 years, with the help of many legislators, there's too many legislators to call them all out, but I will mention a few. Dr. Jeff Steinborn, who I think is here, Dr. Martin Hickey, they're both senators, and Andrea Romero, who will be speaking later. So I thank them and a lot of people for that. So when we went to do this, I went back a little bit to the proposal that had come out of the community work, and we realized that in New Mexico, it wasn't going to work if we simply had access, to therapies, but no access to how to pay for them, no access of ways to bring it, because most of the people I work with don't have the kind of money to be going to retreat centers, to be paying for individual therapy. So we started looking at what are alternate models to do that. How can we come up a way of promoting access? One of the ways of promoting access is the way that you access all the rest of your medical care. Somebody pays for it for you. And so that's one way that we wanted to look at. Can we have access where insurance companies, third-party payers, Medicaid, Medicare can do that? If that's going to happen, you need to have a diagnosis. And one of the reasons that the bill, has 4 diagnoses as therapies is to look at that, to try to develop a pathway through that there can be access to many people in New Mexico, not only the people that can afford self-pay. That's what we're hoping for. The state has been totally on board with the idea of supporting access. An equity fund was created in the bill with the support of DOH and the legislatures, which needs to be funded each year, but the hope is that that'll have $1 million or more and can actually fund therapies for people who don't have the means and have the conditions of substance use, depression, PTSD, and end of life. We're really happy about this. This is like the first, as far as I know, the first time in this country that there's actually been an equity fund where we got past decrim, we got past personal use, we're going to actually help you as a state, and I'm so proud of our state. So I'm going to dive into some ideas that we have for how to try to make this accessible, how to be able to scale this up, talk about some pilot studies. But to go back to that, this is not something that we're just trying to make up in the university. We're trying to follow what happened earlier with the reach out from the state. So we're doing community engagement process. The community engagement process involves meetings led through the Health Equity Council and other sources to get input on how to do the pilot studies and ultimately to get input on how the state program should run. We've been lucky enough to partner with a group that was initially Psychedelic Health Equity Initiative, now Psychedelic Mental Health Alliance. A big thanks to them. They actually saw our original proposal from northern New Mexico and have been a partner in trying to help us get funding and a plan. So thanks to them, thanks to the Health Equity Council. So we presented some of this up in Denver and presented a vision for access and equity. The people that are standing up there are some people who you're going to see today, so I won't necessarily call their names out. You'll see them soon. There are two people that were up there, veterans, that were speaking powerfully and are both working in collaboration with us as peer navigators. We had a Health Equity Council person there. We all presented this as a united vision. So pause a little bit of breath here, because it's going to get, I give a lot of wonky talks about research. I promised Michael and Adele I would not give a wonky talk, and that this would be a talk for my heart, and this is what it is. The next little bit's the wonkiest, because it gets in a little bit of the details. So take a breath, follow me on this part of the journey, and know it'll peak and we'll go down from here. So part of it is looking at the therapeutic team. So as Dr. Weil mentioned, the container, the set and setting, we think is so important. And so the container that we're talking about is to have a group of participants, perhaps ideally about 5 or 6, to have PTSD and psychedelic therapy facilitators. These are studies for PTSD, and then to have peers in there. One of the issues that occurs in all therapy, but especially psychedelic-assisted therapy, is the issue of social position. I think that could actually be really challenging if you had a group that had nothing but therapists and participants. We don't want that. We want to bring in people that are involved in each of the groups that we're looking at, the affinity groups, and so we're going to be training peer navigators. We hope that's a model that'll, again, both improve the therapy and improve the access. The other thing that we're working on, and I'm not going to go too much of the details, is that we need to figure out how to train people. There's particularly group psychedelic therapies have mostly been done traditionally. They've been done in the underground. There's been a few studies that have been done, but we need to learn that. So we're collaborating with Heroic Hearts that's been doing that work. We're excited about that, working with the veterans. We're collaborating with people from the Southwest College. We've been reaching out to people who have thoughts and visions on working with Indigenous people. So we're trying to really have that all as part of our training. So what do I mean when I'm talking about peers and affinity groups, and what is he talking about there actually? So let me put that more into normal language. What we're talking about, if you're going to be sitting there and that you're a veteran that has PTSD, that you're not just going to be with people who are therapists, but people who've actually done work on this themselves, that have done their own healing, that have PTSD. Each affinity group will have some difference in the training of the peers. The other group that we've had an interest in the community is working with women with sexual trauma. That group, I think, needs a whole different container, a group that's all led by women, and we're actually looking at the birth center in Albuquerque that's interested in having us use the birth center, which actually is a health facility and should be relatively easy to do work with. But these are all still in facilities, and I just want to mention other ways. So another interest that's being explored is working with Indigenous communities. We're in conversation with the community with the idea of doing the preparation work in the community there, having the medicine journey down in Albuquerque at this point, because it needs to be for FDA, and then come back to the community. I think if we can do that, that's a great step at bringing this work, out of the lab, so to speak, and into the community. As we're designing the program, there's other things that we've learned from our talking with the community. One is to try to extend the integration. The idea of that you're in a study and then 4 weeks later you're not in the study and you don't have support is not a good way to work with things like trauma and addiction. So we're going to have prolonged peer-led integration, work on community-based integration programs, and circles of mapping care. So just to mention a little bit, I mentioned some on these community sites here, but I think that there's a lot of different places and sites to potentially be doing psychedelic-assisted therapies, and we're going to try to pilot as many of them as we can over the next 2 years. Those are our goals, to hopefully not just do studies at UNM, but get out to those community settings. Thanks for being on this journey with me here. I'm going to have to wrap it up a little bit here, so hopefully we're all taking some breaths. We're coming down from this part of the journey, but as you know, there's waves, so there'll be other speakers with their journeys for you. There's too many people here for me to actually read them all for gratitude, but I just want to be clear that this clearly does take a village. The people we've had working both in the research, the therapy, legislative, everything has been amazing. I thank everybody on this list, and I thank all of you for being here, and everybody I haven't thanked. So thank you so much for being on this journey.